In this video, we will discuss the difference between stress and strain in the context of healthcare. Although both are closely related, they are both distinct from each other. We will explain the difference between both. Also, we will identify the different personal stressors and their corresponding strains. Also, we will outline effective coping mechanisms that you could apply in your healthcare role to mitigate the effect of stress upon your life. Let us start by understanding what stress is. Work-related stress is a response people may have when presented with work demands and pressures that are not matched to their knowledge and abilities and which challenge their ability to cope. In healthcare, this can include high patient loads, time constraints, emotional demands, and organizational changes, among other challenges. Stress is characterized by the anticipation of a threat or a challenge, which can activate the body's stress response systems. On the other hand, strain, which is closely related to stress but still different from it, is our internal reaction to stress. It reflects how an individual responds to stressors which are external to our body. It includes the psychological and physiological consequences of prolonged stress exposure, such as burnout and anxiety and depression. Strain can manifest physical symptoms like headache and fatigue, or emotional responses, among different other negative consequences that could strain cause to our bodies, whether physically or mentally. Now let us discuss some physiological and psychological responses to stress. Let us start by some of the physiological responses to stress. Our body's stress response is primarily governed by the hypothalamic pituitary adrenal axis, which regulates the release of key stress hormones like cortisol and adrenaline. This system prepares the body for fight or flight response during stressful situations. However, prolonged or dysregulated stress responses can lead to negative health impacts, such as increased susceptibility to mood and anxiety disorders like major depressive disorder and post-traumatic stress disorder. Beside the physiological responses to stress, there are also possible psychological responses. Psychological responses to stress may include anxiety, depression, and cognitive impairments like difficulty concentrating. Healthcare professionals may experience compassion fatigue or secondary traumatic stress due to constant exposure to patient suffering. According to a study by Dirby et al. In 2017, medical professionals report high levels of emotional exhaustion and burnout, significantly affecting their job performance and well-being. Now let us summarize the difference between stress and strain. Simply, stress represents the external factors such as workload, patient demands, organizational culture, and interpersonal relationships that contribute to our stress. It is often acute or chronic, depending on the duration and intensity of the stressors faced. On the other hand, strain is a subjective experience. It's something from our inside, varying among individuals based on their coping mechanisms, resilience, and support systems. While stress is often visible through external signs like irritability or tension, strain manifests itself internally, affecting mental health and overall quality of life. Over the rest of this course, we will try to explore the reasons and the dynamics behind interacting stress and strain and how to cope with such responses.